has heard from the man's mother. She's offered a completely different version of the events that led to the death of Ron Hall. Hetty Corby reports.
Barbara Hall says her son Ronald, who had Down syndrome, was very frightened by the prospect of a tooth extraction. To ease his anxiety, she says Dr. Andris Kalupnieks authorized 5 advanced doses of a tranquilizer and anti-anxiety drug. That contravened written instructions she had received from the dentist, and it's an allegation he has denied. Hall told the inquest the dentist then sedated Ronald with 4 injections. When he finished the procedure, she testified, he said to me, I gave him enough to knock out 3 people. Dr. Kalupnieks has testified Ronald came to and sat up and hugged him. According to Hall, the dentist never entered the recovery room. She said Ronald was still sound asleep when he was discharged. He couldn't talk or move, and they had to carry him out of the office. She was asked, did you protest at all that Ron would be released in your care under those circumstances? No was the answer. There are 2 nurses and a doctor there, so you presume they know. For 9 hours, Hall said she monitored her sleeping son. She shook him and tried to sit him up. Then Dr. Kalupnieks phoned. She denied telling him Ronald was walking around. I told him Ronnie was still asleep, and he said, you'd better bang some pots and pans, because he'll have you up all night if you don't wake him now. Hetty Corby, CBC News, Toronto.
And a follow-up to a story we told you about.
An Etobicoke man has left many questions unanswered and his family angry and frustrated. Health specialist Judy Halliday has been following the story since the beginning.
25-year-old Ronald Robert Hall died in his home 10 hours after receiving sedation for dental surgery.
After 2.5 weeks of testimony, the inquest jury could not arrive at the cause of his death.
I'm not satisfied with it. I hoped we'd have gotten more out of it, but going out the same way I come in without any answers.
The jury did make 22 recommendations. All were directed to the Royal College of Dental Surgeons, the regulatory body for dentists and oral surgeons. They dealt with many aspects of dental practice, including the treatment of developmentally handicapped patients like Ronnie Hall.
I think the recommendations are going to be actively considered by the RCDS. Many of them, I would think, have some viability and will be implemented ultimately. Others may be doubtful as to their practicality.
They said that there seems to be a lot cancerous in the field of dental surgery, and I think that all dental surgeons and their governing body, the Royal College of Dental Surgeons, should be looking at these recommendations.
Family members say they're happy with the recommendations, but they are not happy with the process. They say their next step is to lodge complaints with both the Royal College of Dental Surgeons and the Royal College of Nurses about the practices of the dentist and the nurses involved in Ronnie's care shortly before his death. At Coroner's Court, I'm Judy Halliday for City Pulse Tonight.
To Toronto will return tonight with recommendations in the inquest into the death of 25-year-old Ronald Hall. He died just hours after undergoing dental surgery. Hall suffered from Down syndrome. He received an anesthetic, and his parents testified that he never recovered, but was released from the dentist's care anyway. Well, tonight the jury made 22 recommendations. The main ones are establish a study program for dentists who treat physically or mentally disabled people or people who are mentally challenged. The Royal College of Dental Surgeons should implement a regular audit of the 150 dental surgeons in Ontario, and standards should be set up for record keeping by dental surgeons. Well, Durham